Hey folks, this is Dr. Casey Ashby from Adult Pediatric Ear, Nose, and Throat here in Kalamazoo, Michigan. Today I was going to talk about a little more serious topic than we've talked about in the past. We've talked about ear tubes, tonsils, tinnitus, sinus issues. Today I'm going to talk a little bit more about something that unfortunately we see rather regularly, and that's cancers of the head and neck region. As ear, nose, and throat specialists, this is something that we deal with on a regular basis. Most often, the types of cancers that we are dealing with are going to be what's called squamous cell carcinoma. That's usually cancer that comes from somewhere inside the mouth. Could be the mouth, could be the back of the throat, could be the voice box. Other types of cancers that we deal with are thyroid cancer and also skin cancers. So when we're talking about head and neck cancers, essentially cancers of the throat, we're talking about squamous cell carcinoma. There's a number of ways that these types of cancers can present. Most often they present with soreness in the throat, pain in the throat, trouble swallowing. Oftentimes those things come along with pain in one ear or the other. Sometimes weight loss. Oftentimes they will present with a bump in the neck that wasn't there before. Oftentimes people will tell me that they found the bump in their neck while shaving, or a spouse or a family member noticed it while they were looking at them. So usually these people have been dealing with this for some time already by the time they get to us. Unfortunately, it's oftentimes thought that it might be a viral process or an infection. It may have been treated with antibiotics before they get to us. Eventually it gets progressively worse and worse to the point where the person's doctor or the patient themselves feel like their care needs to be escalated. That's when they end up coming to see us. Typically, again, most often we can kind of determine what's going on based upon the person's history, the things that I had mentioned before. And usually, again, this is something that's been going on for a number of weeks, sometimes even months, unfortunately. And usually we're not talking somebody who's had, a cold or a sore throat for a week or 10 days. Usually this is something that's been going on for a little bit longer. Sometimes it will present sooner, but usually it's kind of a picture of a process that's been happening for a while. Other things that it can sometimes present with: hoarseness, or trouble breathing, or sometimes it's just the sensation that there's something stuck in the throat. Rarely the sensation of something stuck in the throat is cancerous, but if you are having that type of symptom and it's not going away, it needs to be evaluated. When people come to see us in the office, we're going to take a thorough history, we're going to do a physical examination, we're going to feel the lymph nodes in the neck. If we feel a mass in the neck, it's possible that that's cancer that has spread into the lymph nodes. Then we're going to do a thorough examination of the inside of the mouth. Oral cancers can develop on the inside of the oral cavity, along the jaw, under the tongue, on the cheek, or in the back of the throat. Probably most often what we see is cancers in the tonsil or along the back of the tongue. These cancers in the past, they all used to be due to tobacco use and alcohol use. And those two things combined have a synergistic effect and increase the risk of these types of cancers. What we're seeing these days, most of the time, if we're seeing a cancer on the tonsils or along the back of the tongue, usually this is due to the HPV virus, or HPV. You've probably heard of HPV as the primary cause of cervical cancer, but unfortunately we see a significant number of patients who have HPV-related cancer of the tonsil or the back of the tongue. Still, when we're talking about cancer of the voice box, that also is squamous cell carcinoma, and that usually is related to tobacco and alcohol use. Now, During our examination, usually what we'll do is we'll take a good look down in the voice box, and we do that with a little fiber optic camera. We'll put a little numbing spray in the nose. We've got a little spaghetti noodle-like camera. It goes through the nose, allows us to take a good look down there, take a picture. Now, if we see something in the mouth or in the throat, usually we can biopsy that here in the office. We'll do a little numbing medication and take a small portion of that tissue, send it off to the pathologist and have it analyzed. If it's deeper down in, if it's not an area that we can access here in the office, then usually we'll end up in the operating room. And in the operating room, while the patient is asleep, we're able to get down deeper into the throat, take some biopsies that way. Then we take those specimens and we send it to the pathologist. Oftentimes what we'll do if a patient presents with a mass in the neck, usually what we'll do is we'll send that person for a biopsy of that mass. We call it a fine needle aspiration biopsy. And what that means is a very small needle is inserted into the mass and cells are taken out of it and sent to the pathologist and analyzed that way. It's pretty sensitive test as far as tests go. Usually there's a number of scans that will need to be done. Usually we'll end up getting a CAT scan of the neck, sometimes of the chest as well. Once we get a confirmed diagnosis of cancer, oftentimes that's going to require a certain test called a PET scan. A PET scan looks for increased metabolic activity throughout the body, and it's looking for tumor cells that may have spread to other areas. Unfortunately, people who have cancer in one area, usually from tobacco and alcohol use, they're at a bit of a higher risk for having cancer in the lungs. Usually a different type of cancer, but unfortunately we will oftentimes see that. Sometimes it's cancer that's spread into that vicinity. Now onto treatment. There's a couple different ways that these types of things can be treated. And I always tell patients when I give them this diagnosis that they are at the beginning of a long, hard road. The treatment for cancer is no walk in the park. Most of the time, the treatment requires radiation therapy and chemotherapy. And we've had very, very good success with these treatments. I will send these patients to the Cancer Center here in Kalamazoo. They do a fantastic job. They also work very closely in conjunction with some of the physicians at the University of Michigan, and oftentimes will share some of their protocols. Radiation, chemotherapy, these are not nice things. They're fairly toxic. However, oftentimes it takes something really bad, really nasty to kill something really bad. And especially with the patients who have the HPV cancer, they are very treatable with this regimen. And I've got many, many patients who've gone through this therapy. They're living healthy, happy, productive lives, and they require close follow-up for a number of years. They will usually alternate between myself and the oncologist. We get to know each other pretty well. We'll do a number of scopes to be thorough and keep an eye out for any recurrence, which is a possibility. But most of the time, when we're dealing with HPV-related cancers, usually of the tonsil or the back of the tongue, oftentimes we can get a cure. Again, there's side effects from chemotherapy, there's side effects from radiation, but we usually have a pretty significant success rate. Other types of things that we will deal with, or other options actually, sometimes surgery is an option for treatment. Usually we start with chemotherapy, radiation. If that fails or if cancer comes back, oftentimes it requires surgery. Some surgeries can be performed here in Kalamazoo. If it's more significant, I will oftentimes send people to the University of Michigan, where they've got excellent head and neck surgeons. And there's a number of excellent head and neck surgeons in the Detroit area as well. Surgery oftentimes is the second line treatment. Sometimes it's the first line treatment. And in some scenarios, people can be treated with surgery only, and they can be spared chemotherapy and radiation. So it's really, really dependent on the person. It's really dependent on the cancer, and everybody's an individual. Every scenario is a little bit different. Okay, other issues that we deal with. We do deal with thyroid cancer. First of all, thyroid nodules are extremely common. This is an entire topic all to itself. Thyroid cancer is generally very slow growing, usually not very aggressive, and usually very, very treatable, oftentimes with surgery alone, but sometimes in conjunction with oncologist or the endocrinologist to treat it with what we call radioactive iodine therapy. That's not like getting radiation therapy for the other types of cancers we talked about. Usually it's a pill. They take the pill. Any residual thyroid tissue will suck up that iodine and ablate or destroy any residual thyroid tissue. So we've had very, very good success with that as well. Again, I think thyroid and thyroid nodules, that's probably a whole nother topic, a whole nother time here. The gist of it here is anybody who's got concerns, a chronic sore throat, ear pain that cannot be explained. If there's no ear infection, that can oftentimes be a referred pain coming from somewhere in the throat. Could be a tooth. We oftentimes see dental problems getting referred up into the ear. If you've ever had your wisdom teeth out, sometimes the ear pain is worse than the throat pain. But if you've got issues that are not going away, it needs to be evaluated. I would say if you're having pain in the throat and it's lasting longer than 3-4 weeks, you either need to see your doctor or call us to make an appointment. If you've got hoarseness that's not going away and you're having a hoarse voice, it's just not the same as it used to be, any degree of discomfort, it needs to be evaluated. Honestly, most of the time, hoarseness and throat pain, it's acid reflux or allergies. But every once in a while, unfortunately, it is something cancerous. And I would much rather have somebody come to see me and I tell them it's not cancer than for somebody to ignore something that's been going on for a long time and come in, and by that time it's progressed to a point where it's more difficult to treat. So anyhow, I'm sorry that was maybe a bit of a more depressing, a more serious topic than we've discussed in the past, but it's an important one and something that we deal with on a regular basis. So if you have any questions, please leave them for me below. We're still here functioning. I saw about 12 telemedicine patients today. We are still seeing patients online. I'm only seeing urgent stuff here in the office. So if you have an issue, please feel free to give us a call. I'm happy to do a telemedicine consult. I may have to tell you, okay, we'll see you in the summer. We'll evaluate further at that point in time, but at least sometimes we can get a process and a plan started. So please give us a call if that's something you would be interested in doing. Also like to give a little shout out to the local small businesses. Please support your small businesses. Everybody's going through a really hard time right now with a decrease in business. I know it may seem strange, but our practice is essentially a small business. We depend on the business that we do to keep the doors open, to pay our staff. We are a private practice. So we've still got people here working, being employed. We're staying safe. Again, hopefully things will be up and running soon, and look forward to seeing you all in the near future. Stay strong. We'll all get through this. Please, if you have any questions, leave me a comment below. If you have suggestions for another topic, please leave me a comment. Today is Wednesday. I think I'm losing track of the days. We've got a couple more days this week. I may do another one tomorrow or Friday. Please give me a suggestion. What would you like to hear about? The week after this, Dr. Barry will be here again. I know you guys probably like watching her better. She's much more articulate than myself. I tend to ramble, but thanks for watching. I've got, only one viewer right now, but maybe later. Thanks, guys. Bye.